In the wake of the COVID-19 pandemic, a rise in crime rates has become a great concern across Colorado and throughout the nation.
And our community is our biggest ability to address this. Working with our community is critical if we want to reduce crime and have a safe Denver. Now, oftentimes we make assumptions that we know what drives crime. Oftentimes people will talk about the economy. Well, we have to challenge those assumptions, because if you look at the crime in Denver or the crime in Colorado during the Great Recession, 2008 through 2012, we actually did not see an increase in crime. So we really need to look at what is occurring. Many of the experts will not talk about poverty in and of itself being a causal factor, but they point to trauma. People that are exposed to trauma as being part of a cycle that continues to perpetuate violence. So you have to be flexible in your approaches to both the hotspot policing as well as treating individuals as individuals, and how you can best connect them to the assistance that can help them on that individual level. Particularly when you're talking about human beings, you have to be flexible and make sure that you're examining the evidence, examining the data, and having that flexibility to adjust in order to help our community. We'll also continue to work with our city partners, DOTI, DEDO, the Denver Department of Public Health and Environment, our HRCP, the fire department. There's so many different agencies that are helping us to address the violence that we're seeing that's concentrated into a few hotspots.
Through coordinated efforts, the ability to effectively reduce the rising crime rates is possible.
Incarcerating somebody for drug use may solve the problem for a matter of hours. It does not solve the problem indefinitely. And so connecting people to services that they may need and connecting them for as long as we possibly can until they're able to get back on their feet or actually get into recovery is really the goal. And that's what's going to prevent future problems for a lot of folks. So more often that we're able to divert from a direct police response or add to a police response a mental and behavioral health response, the better. I'll also just say that, not every substance misuse issue is somebody that's on the street. A lot of substance misuse issues happen in homes, and overdose issues happen in homes. And so finding people and helping them where they are isn't just about finding people on the streets, it's about finding people wherever they may be. And so that's why we want to raise awareness as far and wide as we can, so that people know that it may be a loved one, it may be your neighbor, it may be your coworker that actually has a substance misuse problem. And starting to address some of that stigma of actually getting services and getting the right services is one way that we approach getting people connected to services and addressing the issue more broadly.
An assessment intake diversion center will operate 24/7, 365 to connect those in need of mental health and drug addiction services with resources. The STAR program will expand across the city. The addition of a second Wellness Winnie to enhance community outreach, plus mental health services and support for inmates in city jails, and the Solution Center will work with those transitioning out to avoid being on the street.
So substance misuse we think of as really a condition, a mental and behavioral health condition. And so it is embedded in our broader mental and behavioral health work. And we like to think of it comprehensively. We want to work with partners in the cities, partners in the community, other city agencies. We think it takes a holistic approach to addressing substance misuse issues. We want to meet people where they are. We want to provide services if they're ready for services. We want to provide supports if that's what's needed, whether that's treatment if they're ready for treatment, or connection to service providers if they're needing other service providers, or even social services, things like food stamps, or providing WIC vouchers, or providing connection to homeless supports or housing supports. It could look a variety of different ways. That also could be delivered a number of different ways, whether it's through the police department and a police response, or whether it's through a partnership of mental and behavioral health providers coming alongside police response or whether it's through a variety of the mental and behavioral health outreach teams that we have in Host or in our office or as contracted individuals throughout the police department as well.
It's only through a coordinated, thoughtful, and effective collaboration between law enforcement, addiction and treatment resource providers, as well as the community at large, that Denver can manage this current challenge. For more stories, check out Denver's YouTube page or tune in to denver8.tv.